Welcome to today's episode of CHS Presents Lifestyles at the Heart of Health. Whether it's a constant ache or a sharp pain, 80% of us will experience a significant episode of back pain during our lifetime. Our bodies know how to signal to us that something is wrong, and in some cases, back pain may be a sign for something serious. Today, we will explore when you should seek help and share some tips and tricks to try to avoid it. All of this is coming up on today's episode of Lifestyles. Hello everyone, I'm Jane Hansen. Thanks so much for joining us. Back pain can be mild or severe, short-lived or long-lasting. So how do we know if we need to see a doctor? Joining me now is Dr. Kevin Mullins, the chairman of Catholic Health Services Division of Neurosciences, who's going to answer all of our questions. Welcome, doctor. Good to see you here.
Good to see you too. Thank you.
So, Division of Neuroscience, you are a neurosurgeon, and I have never thought of back pain as being under the realm of neurosurgeons. Most people don't.
I think you're correct. Most people think maybe of an orthopedist as managing a lot of back conditions, but one of the primary services that a neurosurgeon provides is the care of the spine, both the neck and the lower back, and it is the most common problem a neurosurgeon will take care of.
So it's 80% of spinal problems, it's what you guys do.
We spend most of our time taking care of spinal disease, especially in the setting of being in the community, and we are, to some degree, the primary caregivers for lower back pain and neck pain.
So when somebody has back pain, there could be a multitude of reasons for why they have it.
There certainly are. Most patients will have back pain due to simple muscular issues in their lower back, and that's usually a very self-limited episode of low back pain, and it's not accompanied by any more concerning symptoms. Other patients might have more serious causes of their low back pain in the form of degeneration of the discs in their lower back or arthritis of the joints. Those patients might just have back pain, but a minority of them may also have problems with pressure on a nerve and develop leg pain.
So that's like a pinched nerve. That's
like a pinched nerve, and so a lot of patients may call that sciatica, meaning pain going down their leg. And sciatica is a general term to describe a pinched nerve. And as I said, most patients have pain just that stays in the lower back, but some will get a pinched nerve, and the majority of those patients will feel pain down their legs.
So when somebody comes to you with back pain, how often do you actually end up doing surgery?
Rarely.
Really?
Really. I know that's another misconception by some patients who feel if they're referred to a neurosurgeon, they're concerned that they need surgery.
That's it. Start cutting.
I think in reality, we spend most of our time evaluating patients with back or leg pain, neck or arm pain, and determining non-surgical treatments for them and referring them to those services. With a minority of patients, if they don't benefit from those services, from non-surgical treatment, a minority of them benefit from surgery, and that solves their problem.
Right. So, but the time between when they first notice the pain to actually having surgery probably could be years.
It can vary depending on the severity. So, if a person has a very severe problem, it might be a number of weeks or months before they have surgery from the onset of symptoms. But you're correct. A lot of patients have suffered from years of back or intermittent leg pain, and they finally get to the point where it's become unbearable, and they go through a course of non-surgical treatment, and if they don't get better, they may choose surgery as a best option for them.
Is it pretty rare that this is caused by a real injury, or is it mostly just kind of this process of degeneration?
So it's mostly the process of degeneration, and there might be one last event that throws the person over the edge. And I think everybody wants to have an event because they want to explain why they suddenly have a terrible problem. But for the majority of patients, they've gone through a period of degeneration of a disc or of the joints of their lower back, and it finally reached what I would say is a tipping point where one episode threw them over into a series of more serious symptoms.
How much of it is age-related?
Well, there certainly is a component that wear and tear, age, plays a role in degeneration. The part that we don't understand as well is that some people seem to wear and tear more quickly than other people, independent of their activity. So there probably is some genetic component that we don't understand well enough now that's part of the equation.
Sure. Well, you have a patient, and we went out to see you in your office and talk with your patient. So let's take a look at that first, and then we'll talk again.
Catholic Health Services provides a spectrum of care from the beginning to the end of caring for this patient with spinal disease. That includes the initial evaluation and workup, which can include imaging, CAT scan, MRI imaging, which all the hospitals are able to provide. They also are able to provide interventional pain management services. That includes people that come in and receive epidural steroid injections or facet blocks. That's another more aggressive treatment for persistent back pain or leg pain. And if patients don't improve with those conservative treatments, they have the full surgical services in the operating room, in the hospital, post-operative care. And then once the patients had surgery, they can also be transferred into acute rehabilitation or subacute rehabilitation through Catholic Health Services hospitals and subacute hospitals. So back pain is probably the most common problem that we take care of in patients. So most patients are going to experience back pain in their lifetime, and both neurosurgeons and orthopedic spine surgeons are the primary specialists that care for that problem. So it's something that we see every day and care for every day. Most of it's self-limited, and it's not a serious problem, and most people can just take it easy and it will go away. But patients that have more serious symptoms that include symptoms of nerve compression, which would be leg pain, leg numbness, or certainly if anybody progresses to the point where they have weakness in their legs or problems going to the bathroom, those are much more serious issues that we always tell people to seek out medical care immediately. If we evaluate patients in the office and they've had a short course of lower back pain that has resolved, we usually don't require any further workup or treatment, but rather recommend to them a course of exercises for strengthening the lower back. For those patients that have persistent lower back pain or any neurologic symptoms, then we move forward with a more extensive workup that can include MRI imaging, physical therapy, interventional pain management, and in a minority of patients, surgery. All those services are available at Catholic Health Services hospitals, all the way from physical therapy to post-surgical rehabilitation.
My arthritis tends to get more and more horrendous. But it got to a point where now it hit me in the shoulder, and instead of petering out with all the new drugs I use, it got worse. Went for an MRI, saw the cyst. And he gave me an option, either have surgery or have cortisone shots. They got me down to surgery, and they prepped me down there, and they brought my husband and daughter downstairs. And Dr. Mullins came in, told me what was going to go on, and before you know it, I went to La La Land. They woke me up. Oh, look, she's smiling. And from there on, it took over there, and they brought me up to the ICU unit. And I don't have to tell you how wonderful they are there.
Obviously, Joyce is one happy patient. She calls you guys wonderful. She's kind of representative, though, of the full services that one can get catering to your individual needs within the Catholic Health Services.
I think that's very true. Joyce was able to go through hospital services all the way from the emergency department to the operating room to the intensive care unit and to the floor with post-surgery rehabilitation, all on a weekend. So Catholic Health Services hospitals have a broad range of services that are available around the clock for patients with serious problems like Joyce.
Yeah, they can deal with just about anything. I have known people who have had back pain, and that back pain has actually been a sign of something else. And in one case, I know it was cancer. In another case, it was some other kind of severe nerve damage. I mean, how likely is that to be the cause of the back pain?
So the majority of patients, as we discussed earlier, is more muscular, and it's somewhat of a benign cause of their back pain. But there are a minority of patients that lower back pain can be a sign of a much more serious problem. Lower back pain that occurs at night is unusual as people lie down. Lower back pain in association with having a fever or weight loss can signify a much more serious problem. And lower back pain when you're developing symptoms into your legs of pain, numbness, or weakness, again, would would be concerning for a much more serious cause of the back pain.
And what about in terms of the surgery? Are there a lot of new developments in the surgical process now?
I think there's been a move towards less invasive surgery, as there have been in all surgical specialties. And so MIS, what we call minimally invasive surgery, is utilized at all the Catholic Health Services hospitals. And that includes utilization of smaller incisions, special retractors, magnification with a microscope, sometimes using an endoscope. So there have been a number of advances and all of the technologies available at the Catholic Health Services hospitals.
So it just keeps getting better and better in terms of what you can give to people once they actually need the surgery.
I definitely think that's the case, and I do believe that lower back surgery has a bad reputation, and it may be reasonably well earned because the technology in the past was limited in being able to solve the structural problems in a less invasive way. But we've come a long way with spine surgery, and I do think that the patient outcomes are much improved, and we can argue towards that by looking at some of the results from patients that have had surgery recently.
Well, that's good to know. I guess lastly, for people that are watching this, when do you think that they should see a physician if they have back pain?
So I guess there are two different categories. I think if somebody has back pain that's not self-limited to 7 or 10 days of just localized back discomfort, I think if that continues, they should probably present to their primary care doctor and have an examination and determine whether or not they need to be referred to a specialist. I think for people that have back pain, that includes some of those more serious problems where they have leg pain, numbness or weakness, they're having a fever, I think they should present urgently to their medical doctor or directly be referred to a subspecialist that cares for spinal disease, because it could be a much more serious issue.
And they don't have to live with it.
They definitely don't have to live with it, and I think that's a big message what we can say today is that the majority of back pain doesn't require any extensive treatment. But for those patients that have protracted back pain or any other neurologic symptoms associated with it, there's a whole spectrum of services that are available, from therapy to interventional pain management to surgery, that can solve their problem.
Well, that is good to know, because who wants to live with an aching back? Thank you so much, Dr. Kevin Mullins. We really appreciate you being here today. We're going to take a quick break, but still to come, some tips and tricks to avoid back pain and advice on how to manage it. We'll be right back. Welcome back to CHS Presents Lifestyles at the Heart of Health. Joining me now is Dr. Stephen Pinsky, president of the medical staff at Mercy Medical Centers and a board-certified physician with Mercy's Pain Management Service, which sees all kinds of patients with various complaints, including back pain. Welcome, Dr. Pinsky. Good to see you.
Thank you.
So how many of your patients actually are complaining about back pain? Is it a majority of people?
Yes, it's a majority.
And what do you think that is that so many people are suffering from it? Does it almost seem like an epidemic?
It's part of the aging process for some. It's the result of too much fun for others.
Oh boy.
So it can be from trauma. It can be just from simple bad luck. I like to tell some patients that tell me that they didn't really do anything too dramatic. I say, well, if you recall that game, Break the Camel's Back, where you put additional straws into the camel's carrying cases, and sooner or later, it's a children's game. That last straw, boom.
Breaks it.
Breaks it.
So something's been going on over a long period of time, and then that's when they come to you. But for a lot of your patients, you would say surgery is not the first alternative for them, correct?
Well, we do a complete intake. We'll speak to the patient, known as a history. We'll examine the patient and make sure that there's no, what we would refer to as red flags. If red flags do arise, then we would have to refer the patient somewhat urgently to someone like Dr. Mullins.
But most of the time, it's figuring out some kind of a program that will relieve their pain and set them on the road to, if not being cured, certainly being comfortable.
Absolutely. I like to tell the patients that I can't guarantee that you'll feel the way you did when you were 16 years old, but we can hopefully make your life better. And even if that includes giving you more good days per year or per month, or getting completely rid of an acute problem, whatever the case may be, we're trying to make your life better.
So how does that work? What is the most usual form of pain management for back pain?
My specialty is interventional pain management. A lot of that involves nerve blocks, such as epidurals or nerve.
Epidurals like one would get when you're having a baby?
Yes, so that's the same. Epidural refers to a layer inside the spine, but in chronic pain management, we're injecting different medications whose purpose is not to temporarily numb the body so that you can undergo surgery such as delivering a baby, having a cesarean section, having knee surgery, hip surgery, for example. But in fact, they're trying to have a different effect on nerves which may have been adversely affected by some process.
Mm-hmm. So epidurals and all kinds of nerve blocks, that sort of thing. I've heard there's radio waves, radio frequencies for heat and cold?
Yes, so we can place needles next to nerves and transmit radio frequency energy either at a high temperature, which is meant to knock the nerve out, or at a cool temperature, which is meant to cause the nerve to function more slowly so that the pain is modulated in a favorable way. And we also can use a different system known as a cryo system where we actually create an ice ball next to
Really?
the nerve, yes. And so in so freezing that nerve, you don't destroy the skeleton of it, but you destroy temporarily the soft stuff. And
So what happens when the nerve comes back? Does it come back regrown, or what happens?
So the pain may or may not come back. Sometimes if we can get an outstanding response of many months or over a year of a pain-free interval, the patient may have cured him or herself in that amount of time, but the pain may have naturally abated. So why not feel the pain while that healing process is going along and is underway?
Is that similar to any other kind of pains, or is it just that with back pain, you're not sure what's really going to work? You can only kind of look at it historically and then look at the patient and their history.
It's similar pretty much throughout pain management. It really is.
So when you are evaluating these people, it's not just your department that's involved in helping manage their pain, right? What else do they do?
We have an excellent inpatient rehab unit at Mercy, which is a wonderful, just on years of rave reviews. They do a great job. And I like to refer patients to facilities that's going to be convenient for them. I want them to get the care that they need.
You know, one of the things that would seem it would be really difficult, if you're in such pain, it would be hard to get someplace for physical therapy, or hard to get someplace for maybe, I don't know how often you have to do nerve blocks. Do you do it just once? And hopefully does that depend?
The stronger the pain, the more you want them.
So how often? Like every...
A common approach is to provide blocks every 1 to 3 weeks for a series of 3 to 6 times, and to see how the patient proceeds and then adjust if needed.
Is there any problem with back pain in terms of that pain being covered by insurance, or the cost of the treatment and all of that?
Insurance coverage is obviously very, very much at the forefront of the nation's
tricky
concerns right now. And in fact, interventional pain management is a bit under of a barrage at this time in terms of coverage.
Right.
So it saddens me to think that there are people out there that may have coverage concerns in between where they're at and where we would like to see them in terms of relief.
But you would like to see them be able to live their lives and get back to as much of normal as they possibly could. I'm sure that's your goal every day.
That's my goal. That's what I do all day long.
Well, and we appreciate it. Thank you so much for being here.
Absolute pleasure.
All right. Don't go anywhere, because we're going to take a break. We'll have tips and tricks to avoid back pain coming up right after that, so stay tuned for more of CHS Presents Lifestyles at the Heart of Health right after these messages. Welcome back to CHS Presents Lifestyles at the Heart of Health. Are you taking care of your back? Well, here with me now for some tips and tricks to avoid back pain is Brian Haley, a physical therapist and center manager for St. Charles Hospital's Outpatient Rehabilitation Center in Melville. Thank you so much for being with us. I'm glad to have you here.
Thank you very much.
You're going to teach me something, right?
I am.
Because what's the biggest problem with people in back pain?
Well, we have two problems. One, what I'm trying to do is prevent the back pain from happening. So people can get it doing sitting things, doing standing things, bending properly, sitting properly.
And most of us don't do one of those things at some point in our life, right?
So the most common one we're going to work on today is sitting.
Okay.
So typically we'll sit if we're doing computer stuff, if we're working at the desk, if we're working at a table. And I want to see how you sit right here.
Well, now that I'm going to sit perfectly.
So we all sit what's comfortable, however it might not be right.
And then I do find myself that I slump as the day goes on, even though I try to sit up straight.
Right, gravity is going to pull our body weight down. We're going to get comfortable, so we're going to slouch. The slouching puts more stress on our back. The back tends to hurt. We don't stop right away. We stop when it gets too severe.
Right. So what's the proper thing to do?
So the proper way to sit is keeping your back and your hips at approximately a 90-degree angle, which is exactly where she is, and having her knees at the 90-degree angle also. If your chair is too high, you may want to put something under your foot to level it out. Okay? We
To
don't
put
want
like
to have you
underneath the
slouch.
feet like this, because,
Right.
you know, with heels
So
on I'm
we can
fine,
put
but if I
something
don't have
underneath.
heels on,
Depending
Got
on the
it.
size of your chair
that
and your
actually
work
is
desk.
very comfortable
Okay?
to have that there. Now, what about when I'm sitting here and my computer, where should that be in relationship to my arms?
We want your arms at the same 90-degree angle. So this is where we're looking for. I know this is not where you're going to be the entire time, but if we can keep this
You're
position the
you're
most
right about
time,
that.
we'll take it.
Okay, so this is what we should be looking for, and this will help us to prevent back pain and to help us if we already have it.
Right.
Okay, very good, got it.
Okay. So that's one segment I wanted to work on. The second one I wanted to show was if we're bending down to pick up something. If we're bending down to pick up something nice and light.
I know I do this wrong.
Okay.
I really do, because I tend to just kind of lean over and pick it up. And that's not right, is it?
Now, what's right is, if you let me show you, you're going to stand, you're going to keep your feet wide, you're going to bend down at the knees, bring the object close to you, and then come up together.
Okay.
Okay?
Yeah, I mean, that seems, I mean, I know this is what you're supposed to do. So it's like this, bend.
Bring it close, and pull right up.
Yeah. Here, you can put it back down. Is there a trick to putting it, same thing doing down?
As you're bending and rising, if you just take your stomach and pull it in a little bit, that'll help prevent your back from either buckling out or tipping the wrong direction.
That's what everybody at the gym always tells me to do anyway. Pull that stomach in.
Pull that stomach in and that'll
So
help
it's almost
everything.
like ab exercises. You get a twofer for it.
You get a twofer.
Okay. Now you've got the book on the floor. What's
So I
that
have the
about?
book. Also, what I wanted to say was, when we're doing things at the kitchen counter, whether it is brushing our teeth, whether it is makeup, hair, things like that, we can also abuse our back. So if we're standing in the wrong position, we put more stress on the back. So at your kitchen counter, you have the cabinet. You can open up the door and put your foot in there. For this, if you grab
really?
a small book,
You put you 1 foot in the kitchen
just one
cabinet
foot.
counter?
Doesn't matter which foot it is. What this does is it stabilizes your back, puts you in a better position, so you bend properly.
Wow, so let me try that. So now I'm at my sink and I'm going to brush my teeth. So I put 1 foot here,
Yes.
and then, so when I'm leaning in,
Right. So instead of bending
oh yeah,
like so,
that's so clever.
you're now
But it
more
doesn't,
stable.
so it doesn't keep you off balance with the 1 foot in front of the other?
Nope.
or
It doesn't
higher?
matter which foot it is. It just levels out your back so you bend properly.
What a great trick. I've never thought about something like that. The things I'm learning today, it's amazing. So what is the biggest common mistake that people make beyond the sitting, beyond the lifting, and then what you're talking about with the imbalance? What other things can we do?
We can do a little bit of exercise, and really, I want to say the biggest problem might be being in these positions for a long period of time. So if you're going to be sitting at your desk doing computer work, things like that, every 20 minutes, 30 minutes, I want you to get up. Even if you just get up, tip backwards once, turn your head once, squeeze your shoulder back once. This promotes a better position.
What about getting up and taking a walk? Is that a good idea?
Same, every 20, 30 minutes, just get up out of that chair, walk around for a minute, and then come back. You'll actually feel better. You'll probably work more efficiently as well.
Because there's probably a little bit fresh air circulating in the brain as well. I've been told that a lot of people now think you should stand and have a standing desk, like a drafting board desk. Does that make sense for work?
I want to say yes and no. It depends on what you're going to be doing, as long as you're standing with the right position. So those people that have the standing desk, the table is going to be high, they may definitely want something like this to put their foot on.
But that's going to be uncomfortable if you're working for several hours, isn't it?
Not necessarily. It's more the position you're in. So if you put yourself in a good position, doesn't hurt.
And what about, I mean, I'm very guilty of sometimes taking my computer and sitting on my bed, and then I'm sitting there working, and I do tend to find I get really slumped. Not good.
you're going to be a patient of mine.
And I know you're really not looking for any more, are you?
No, but listen, we're all going to do what feels comfortable. That feels comfortable, but hopefully some of these tips and tricks will prevent some of your back pain from starting.
And what about any kind of exercises that I could do when I am at the gym or even at home? Are there things that I can do that will strengthen my back?
Yes, it starts a little bit with leg stretches and then building up your core is what we're all going to hear. So just pulling that stomach in, holding that stomach in nice and tight when you're moving different directions. That's the easiest to tell you to start.
When people come to you with really severe back pain, and obviously they're there because they're undergoing some kind of treatment, perhaps the pain management we were talking about with Dr. Pinsky, how difficult is it to even get their bodies moving and getting them right from the beginning?
It's hard because as a person with back pain, you don't want to move. The pain interferes with how you're moving, so you want to sit there and hope that it goes away. So our goal is to say, you know what, you have back pain, the best thing for you to do is start moving.
Right.
It's very hard.
So what do you do first? You just get them walking, you get them doing simple exercises?
We do a similar subjective evaluation. We find out what's happening, how this back pain is starting, why it's there, and then we come up with a conclusion as to what we can do to fix it.
All right, well, you've given me some great tips. I want to invite both Dr. Mullins and Dr. Pinsky to come back in as we say goodbye to everybody. Are you going to take his advice, you guys? Absolutely. He's got some pretty good things to tell us. Come on, put your foot up there, pretend like you're brushing your teeth. But this is really important. What they do after the surgery or after the pain management with his therapy is really important to get them back to a normal life.
Certainly.
Absolutely.
All right, thank you all so much. I've learned an awful lot about back pain and how to deal with it today, so I really appreciate you sharing your knowledge and your stories with us in our quest to keep our backs very healthy. And of course, if you want any more information on all of this, you can schedule an appointment at one of Catholic Health Services' 6 outstanding hospitals, or you can call 1-855-CHS-4500 or visit chsli.org. Thank you for joining us today. I'm Jane Hansen, wishing you goodbye and good health.